They can get within 2 months they can get another. It's recommended that they get another dose, and that might be repeated again depending on the advice of their physician. On the other hand, if you recently had COVID-19, that provides natural immunity for around 3 months. So you can delay vaccination by around 3 months after you recover if you recently had COVID-19. And then healthy children, 5 to 11 years old, also just need just one dose of Moderna or Pfizer vaccine. That's even if they've not been vaccinated before, they just need one dose of the updated Moderna or Pfizer vaccine. Now, next question. Why should I get vaccinated against flu and COVID? And so in this sort of a speech bubble, I put this indicates it's a question from one of the registrants. So one of the registrants asked, what if I just stay in? What if I don't get vaccinated instead, just avoid going out? Well, the reason we get vaccinated is both to protect ourselves and, very importantly, to protect those around you. So, especially as Filipinos, we're very, very social beings. Many of us live in multi-generation families, and then again, we are very social. And with the holidays coming up, there'll be Thanksgiving, Christmas parties. So there are, even if you yourself are young and healthy, there are definitely those around you at work or in your family or at these parties or at church who are in these high-risk groups who would definitely be at higher risk of severe illness and death if you happen to be carrying the COVID or flu and give it to them. Now, you ask, I already got so many doses of COVID. Why do we need another dose of COVID or the flu for that matter? So for the same reasons, both these viruses, as do most viruses, change over time. So our vaccines need to be updated to protect against the most current strains. Vaccine protection decreases over time, so repeated doses are needed to boost our immunity. And again, in those whose immune systems are weaker, again, they need even more frequent boosting. But for most of us, the flu shots given every year, and again, for most healthy adults, for now, COVID shots are given every year, although again, sort of recommendations may change. The COVID sort of, it's a moving target. When should I get my shots? Bottom line, it's November 21. You should get them now. These two shots were released and approved in late August, generally became available in September. For most patients, though, I sort of recommend September, October. But certainly if you haven't gotten, or if your loved ones haven't gotten their shots yet, they should get them now. I mean, Thanksgiving's already next week. And again, with the winter coming on and all these social events coming up, we should all make sure we are already protected ASAP. Can I get my flu and COVID shots at the same time? Yes, definitely. I got mine last month. And it's perfectly safe to get them together. You can even get them in the same arm. The day I got mine, I had the tennis game that evening, so I asked them to give them both in my left arm. It wasn't a problem at all. I am often asked, "Oh, isn't there a combined vaccine yet?" Yes, we wish that there was one. Hopefully, in the years to come, they'll come up with a product. I believe some are sort of in the testing phase, but hopefully in the future we'll be able to get just one jab every fall to protect against both flu and COVID. Question, can I get the flu from the flu shot? And this is always a very frequent concern amongst my patients. Oh, doctor, every time I get the flu shot, I get the flu. No, you cannot get the flu. These vaccines do not contain any live viruses. They cannot cause infection. However, yeah, they can make you feel a little poorly. They can have side effects, mostly just a minor side effects, a sore arm, feeling tired, feeling feverish for a day or two. And these side effects don't mean that you got infected by the virus. They're often signs of your immune system building up defenses against the virus. So again, that's the whole point of these vaccinations, is to rev up your immune system. And sometimes that means bringing on these side effects, especially these sort of low-grade fever type side effects. Another registrant asked, what are other things we can do to stay healthy? So remember, apart from vaccination, yeah, need to always wash or sanitize our hands. Don't avoid touching your face, avoid sort of touching high touch areas in public without cleaning your hands after. It's important to eat healthy to maintain a strong immune system. Exercise will help that too. And then if you are sick or feeling like you're coming down to something, yeah, it's important to stay home. And similarly, when you're out, sort of avoid contact with people who are having symptoms or are ill. Now, moving on to sort of the vaccination rates in the Philam community, and how well are we protecting the Filipino American community against flu and COVID? So, first of all, in general, in the U.S., 34% of adults, as of a couple weeks ago, just 34% of adults had received the flu vaccine. So this graph here, so the green graph shows the 2024 data. And these are the different weeks, the current weeks leading up to from late August to November here. The blue graph shows the data for the same weeks last year. And so you can see that the numbers are pretty much the same this year as last year, and sort of it plateaus at around just about around 45%, and we're on track to do that. The sort of a target ideally would be 70% coverage in the general population, but yeah, we're far from there, unfortunately. Now, that's in the general among all adults 18 and above. For those 65 above, again, this is one particular special target group. We have, fortunately, better coverage. 59% of adults 65 and older have received the flu vaccine this season as of November 9. Again, these are on the graph here. 50 and 64, lower than that. And then the lowest coverage rates are in 18 to 49 years old. What about Asians? So among US adults, Asian Americans have the highest flu vaccine uptake among different racial and ethnic groups. So 44% so far this season. Compared to Pacific Islander Hawaiian, 39%, whites are 38%, and the Native Americans actually are doing fairly well so far this year, 35%, Black non-Hispanic Americans at 32%. Unfortunately, our Latino countrymen are at only 24% again. So throughout the pandemic, we've seen a lot of these health disparities in different racial ethnic groups. What about Filipino Americans? So again, the problem is often, yeah, we're lumped together with other Asian Americans, and we of course know that that's a very heterogeneous group. Unfortunately, sort of this aggregate data is usually what is produced, and it's a little harder to tease out for special groups like Filipino Americans. So for flu vaccination rates, for instance, you have to go back sort of many years. the best data is back from 2009 to 2012 from this study published in 2018. And in this study, looking at different ethnic groups in New York and LA and Orange counties, Filipino Americans, again, this was just in LA and Orange counties, had fairly good vaccination rates. This is adults above 50. There were 66% of the Filipinos in this study were protected, were vaccinated against the flu for that season, compared to non-Hispanic Blacks. So there was 53% in New York, but just 40% in LA, for instance. So again, fairly good, but this was, again, back in 2012. Again, it's a recurring problem that we do not have the disaggregated data for vaccination rates readily available or currently available. What about COVID-19 vaccination rates in the PhilAm community? Again, that we have a little better data. Again, often most of the data is, again, lumping us together with Asian Americans. And at least by race, ethnicity, Asian Americans have had the highest COVID-19 coverage with 95% of adults aged 18 and above have received at least one dose as of November 2021. So that's very good. But again, that's just one dose. And again, this was of course, there were a lot of mandates for work, for school, for travel. So many people did get at least one dose. And at that point, 95% of Asian Americans had. And among Filipinos, it was similar. 92% had received at least one dose of COVID vaccine by November 2021. So generally good. Now, but what about this year's updated booster? How often have Filipino Americans gotten this year's COVID booster? We do for in the U.S. in general, the rates have been low, actually even lower than flu for U.S. adults in general who have received the current COVID-19 vaccine. It's just 18% as of 2 weeks ago. This was just in the MMWR. The CDC just released this data today. And in this survey, 13% do plan to be vaccinated against COVID-19. 27% said they will probably be vaccinated or we're not sure. And dishearteningly, the biggest of 42% reported that they will probably or definitely will not get vaccinated. Again, sort of just showing how another reflection of how in so many ways our country is so very, very polarized, and some people sort of feel very strongly about these vaccines. So in the Filipino American community, again, we have data for Asian American adults above 18. And this year, 26%. So again, better than average. And unfortunately, for the current year, we do not have any data yet for the PhilAm community. We do have some information, though, some lessons from the field project, and I'll sort of refer back to this later on, and it's in the talk. But this was, again, a sort of a community-based study in Southern California in 2021, a survey of over 200 Filipino Americans, mostly around LA. And sort of just to try and describe their experience and the outcomes during the pandemic. Majority in that study of the respondents had received at least one dose of a COVID-19 vaccine as of that time in 2021. And most, 77%, felt that the COVID-19 vaccination was a personal responsibility to others rather than just a personal choice. So that's, again, important. I'll refer back to this later. Another important piece of information from the field project was they asked about trusted sources for health information. These are the top answers. The number one was a doctor or medical professional. The internet, of course, the internet can be a very double-edged sword. Then a health organization or agency, and then family members. So that's also important to remember. And then printed materials and friends or coworkers. So again, I'll refer back to this later. Another important lesson from that is despite high health insurance coverage in the among the respondents, again, the 93% of PhilAMs in this study had health insurance. 24% did not actually have a regular healthcare provider. So what can I do? Again, clearly COVID and flu vaccination rates are much lower than they ought to be. And what can I do to convince my loved ones how important it is to get vaccinated? Mainly through gentle encouragement, education, addressing concerns. Again, just going back to that field study, again, family, friends, coworkers were important, trusted sources of information. So again, just sort of if Lola hasn't been vaccinated yet, yeah, asking her why not, and sort of trying to assess what are her fears or concerns. Offer your example. Say, oh yeah, Lola, I had mine. Yeah, I had mine 3 weeks ago. No problem whatsoever. And then importantly, ensure they have easy access to the vaccines. Again, in the field study, a good quarter of the respondents, even if they had insurance, didn't have a regular doctor. So if your loved one doesn't have a regular, maybe it's time if they haven't gotten vaccinated. Yeah, sort of getting them to get hooked up with a primary care physician now might be a good idea, or just again making it easy for them to get the vaccine. Say, Lolo, let's or Lola, let's go on a date next week. We'll go to CVS. We'll get you your shots, and then we'll go have lunch. So again, making it easy, even pleasurable for them to get the vaccine is important. Now, it's not always that easy. So one question from a registrant, what else can I do if my loved ones are very resistant to getting vaccinated? And of course, this is sort of unfortunately, in the pandemic, this was sort of a big issue. We all have, friends or titas, cousins who feel very, very strongly about vaccination, especially COVID vaccines, which unfortunately had become quite politicized. So no easy answers there. First of all, ensure they have someone they trust. Often, again, in the field study, the very top trusted source of information was the doctor. So their doctor, try to make sure they are seeing their doctor. If they don't have a doctor, again, helping them maybe get the doctor so that they can discuss their particular health risks through a doctor or another healthcare worker. Again, a trusted community or church leaders maybe. So find out who they trust and respect, who can talk to them about their specific health risks, particularly if they're in one of the high-risk groups. Importantly, as you talk to them about this, yeah, be patient and kind and non-judgmental. Also, always to give them room to sort of back down so that if they finally change their mind, it's not sort of embarrassing, or it's not like, oh, they lost the debate with you. Okay, so it's sort of make sure it's not confrontational interaction when you're trying to get one of these loved ones to get their vaccines. And I will end there. Thank you, and I think we will open the floor to other
Thanks.
questions.
Thanks, Dr. Abiad. I think Dr. Barroso also wanted to share a few slides.
Oh,
Is
sure,
that
sure.
right, Dr. Barroso? And then we can proceed with the Q&A. Thank you.
So good evening, everyone. I'm going to talk about the basics of vaccination. Some of the questions were already answered by Dr. Abiad. So next slide, please. So what is a vaccine? Vaccine contain microorganisms or virus in a weakened or live attenuated or inactivated or killed state, or proteins or toxins from the organism. So when we say weakened, it's also called live attenuated vaccine, which means the vaccine has been modified so it cannot cause harm or disease in the body. It contains bacteria or virus that have been weakened. And these live attenuated vaccine can provide long-lasting protection. An example of these live attenuated are the MMR, the mumps, measles, rubella vaccine, the varicella, the chickenpox, and the Janus monkeypox vaccine. Now, the inactivated or killed vaccine contain killed version of the germ that causes a disease. The vaccine can provide long-lasting protection. An example of these inactivated vaccine are the hepatitis A and B, the flu, the polio, the rabies, and the pneumococcal. Now, the COVID vaccine, Dr. Abiad spoke about it already. COVID vaccine is an inactivated vaccine that contains the messenger RNA and protein subunits. The messenger RNA vaccine is a type of vaccine that uses messenger RNA, and that will trigger the body's immune response. Also, this messenger RNA vaccine, they teach the cell how to make proteins that trigger immune response if someone gets infected. Also, this mRNA vaccine, they do not contain any live virus and cannot cause infection from the virus. So it does not enter the nucleus and it does not alter our DNA structure. Now, the only non-messenger RNA COVID vaccine is the Novavax vaccine, which is made of protein adjuvant. When we say protein adjuvant, it's a substance that has been added to the vaccine to enhance the body's immune response. Now, we also have the toxoid vaccines, which are the type of vaccine that use inactivated bacteria to create immunity to germs. An example of these toxoid vaccines are the diphtheria, the tetanus, the pertussis, and the botulism vaccine. Next slide, please. Now, why is vaccination important? Again, it helps the immune system develop immunity from a disease, and it prevents spread of preventable diseases in the community. Next slide, please. Next slide. Now, what is the risk of not being vaccinated? An unvaccinated person can infect people of any age, and children can transmit vaccine preventable disease at school and in the community. Next slide. Now, these are possible side effects of the vaccine. So during the pandemic, I was working as a vaccinator, and these are the common side effects that I have seen when I was doing the vaccination. Soreness, redness, swelling from the area, and some patients, they also complain about having fever and chills, fatigue, headache, and the last one is muscle pain. But there are other side effects that have been complained or have been said by patients, but these are the most common one that I have encountered. Next slide. Now, some barriers in getting vaccinated. Lack of knowledge about the indication for and the contraindication to vaccination, or lack of awareness of the importance of the vaccine. Education is very important to increase knowledge about vaccination. Now, negative attitude or distrust is a big challenge. There are those that do not believe or trust that the vaccine will protect them from disease. So during the initiation of the COVID vaccine, I was a chair of the Health and Human Services of Community Board 6, and I organized a town hall meeting in Manhattan, and that was attended by over 200 people. The purpose of the town hall meeting was to dispel vaccine hesitancy, build trust, and encourage people to come for the COVID-19 vaccination. So I believe that this is one way of building trust among communities. Fear of needles. Most people are afraid of needles. So it is important to use appropriate needles and use techniques in vaccination that will lessen pain during injection. Efficacy and safe concerns. Some are concerned that vaccines don't provide 100% protection, and that is still possible, and that it's still possible to get infected even after vaccinated. However, vaccinated people are less likely to get severe infection. And when it comes to safety, the FDA approves vaccine that met strict testing criteria. And also CDC monitors the safety and effectiveness of the vaccine as well as the adverse events. Accessibility or financial challenges. Not everyone has access to vaccine, which impact vaccination rates and coverage. Lack of healthcare services, limited ability to travel, and not having or limited insurance coverage are accessibility and financial challenges. Religious reasons have also caused delay or refusal of vaccination. But remember, there's no scriptures in the Bible that object on vaccination. The major challenges are those denominations that rely on faith healing and not on vaccination. Scheduling days off from work. So not all employers pay employees for time off to receive vaccines. So it's been hard for those that are not paid. Child care of other siblings, families with no help in caring for other siblings will have a hard time to meet the vaccination schedule. Next slide, please. Now, some of the vaccine myths. Vaccine contain harmful ingredients, and some vaccine contained what we call the thimerosal, which is a mercury-based preservative that has been associated with autism and other neurodevelopmental disabilities. Vaccines are effective and they do not contain harmful ingredients. There's no evidence to link vaccines as the cause of autism or the sudden infant death syndrome. Most anti-vaccine information comes from individuals spreading fear, and they're not experts. And vaccines are an effective way to prevent life-threatening illnesses by helping the body's immune response. Next slide, please. So how do we promote vaccination? We can have vaccine campaigns to inform communities about the benefits and safety of vaccines. Example of those can be the Child Health Days, the Child Health Weeks, and the National Vaccination Weeks. And we can also provide financial assistance like free vaccines for adults, teenagers, and children who have no or limited health insurance, and financial incentives for organizations to vaccinate persons with no or limited health insurance. We need to be passionate about patients with mixed feelings and reinforce confidence in routine vaccines. We have to make vaccination a sustainable practice. Vaccines should be given to all to achieve universal health and increase vaccine coverage. And we can promote catch-up vaccination during National Public Health Week, or we can do some patient reminder or recall those that need follow-up immunization or vaccination. And we can hold vaccine clinics at hours that are convenient for families. Now, how is the updated 2024-2025 COVID vaccine? Dr. Abiad already spoke about this, and my slide will also inform you about how different the vaccine from the previous pandemic into the present one. So it's important to keep up with vaccinations that match the strain that is circulating in our environment, because COVID is never going to go away. The virus will continue to mutate and spawn new strains. So it is very important to keep up with vaccination. And the new shots are called updated vaccine. They are bivalent. When we say bivalent, the vaccines contain both the original virus and the new Omicron variants. And the updated vaccine is expected to protect against the newest Omicron subvariants, the XBB.1.5. Next slide, please. So how will the updated COVID shots protect you? Again, the updated vaccines aim to protect against severe illness, hospitalization, and death. They also restore and enhance protection from previous shots, which has declined over time. And vaccination reduces the chance of suffering the effects of long COVID. The long COVID refers to the wide range of symptoms and conditions which can last for weeks, months, or even years. Next one. Now, will the updated vaccine work if new strain emerge? The new strains have emerged already, and a variant called the KP.3.11 in August, followed by the XEC strain 1 in October. But the updated vaccine will continue to help protect against severe illness, even if the virus mutates and additional strains appear. So how safe are the updated COVID vaccines? According to CDC, COVID vaccines remain safe and effective. We have one concern that has been associated as adverse event, the myocarditis, which is inflammation of the heart muscle, and the pericarditis, which is the inflammation of the lining outside the heart. This has been observed mostly in adolescents and young adult males, but occurrence is very rare. And all vaccines have side effects. The most important thing is to weigh the benefits of vaccination against the risk of side effects. Now, should you get an RSV vaccine? The RSV causes mild cold symptoms, but can lead to hospitalization and even death in older people and babies. Vaccines for older people are important because immunity wanes with age and they're unable to fight off infections such as RSV. Children are vulnerable because their lungs are smaller and immature, and making them more vulnerable to severe disease. And RSV vaccines are the Abrysvo from Pfizer and the mRESVIA from Moderna and the Arexvy from the Glaxo GSK. And the Abrysvo is approved for pregnant women to provide antibodies that they could pass to the fetus and protect newborns from birth to 6 months of age from severe RSV. And again, can I get shots for COVID, flu, and RSV during the same visits? So according to CDC, it's safe to get COVID, flu, and RSV shots at the same visit. I think that's all.
Thank you so much, Dr. Barroso, and thank you, Dr. Abiad, for your presentations. At this point, we'd like to proceed with the Q&A. So if anyone here in our meeting would like to unmute, you are welcome to do so. But in the meantime, I'd like to start with a few questions that we actually received from our registration forms. So the internet is a double-edged sword. It's beautiful because for us Filipino Americans, for a lot of us, we have loved ones back home in the Philippines, and it really gives us a very convenient way to stay in touch, though we're like thousands of miles apart. But on the other end of it, there's a lot of misinformation on there, particularly on social media. How can we better equip ourselves to be able to distinguish between information that's accurate or that's misleading?
Dr. Barroso, you want to field that?
So when it comes to information, it's easy to Google, but we have to inform the public that not all information under Google are correct. So we have to make sure that the source is coming from a reputable organization or reputable public health institution, because not everything that is in Google are correct.
Yeah, I agree. Generally, yeah, it's always good to cross-reference, find sort of sites, again, institutional sites. Most large medical centers will have sort of a lot of information out there for the public, or yeah, sort of NIH, and certainly up to date is always most of, for those at least a few who are like for instance medical students will have access to up to date. So definitely all of those would be trusted sources. I think the biggest danger, especially certainly through the pandemic, was really just those all these messages that are sent through social media. Throughout the pandemic, my biggest headache was like, I have a tita in the Philippines. Homer, is this right? Is this true? And it's not just COVID. It's also, oh, this will make you lose weight, or this will sort of all these health claims. And I again sort of I said I just keep telling my from family, just because it's sent to you by your kamajong doesn't mean there's that it's true. So just encourage them to look on trusted institutional websites, and certainly sort of I try to be patient in explaining things and sort of dispelling myths. And it's important also for all of us, when I'm sure we all feel these questions from friends and relatives. It's important to sort of try to be non-judgmental and not try to make anyone look stupid or foolish for asking the question.
No, exactly. I think you bring up a very good point. Having grown up partly in the Philippines, I too received questions like that. And I'm not even a medical doctor in any case, but I think the most important thing is to have someone trusted, right? Whether it's someone who's a doctor, who is a church leader,
Right.
to ask these questions and double check. Because unfortunately, these social media things are so sticky. If you don't have a Dr. Abiad or a Dr. Barroso or an Andrea to check in with, like you kind of just take it without really double checking.
Again, that's maybe one also issue with the Filipino American community. Again, we are and Filipinos even in the Philippines are sort of among the top users of say Facebook, and then of course all of us have groups of like whatever Viber or WhatsApp, and these things are sort of just a breeding ground for this sort of exchange of information and misinformation, unfortunately.
Yeah. And I hope to cultivate personally and in our community too, the ability to speak with humility, because I remember a few times kind of, behind the phone, like, what? They really believe this? But genuinely, my tito thought, oh, like, is it true? Like, garlic water, just chugging that, or like a shot a day should kill the virus.
Right.
And really respectfully, trying to lead them to what's clinically proven and scientifically backed. And another question we have, what are some of the most common vaccine preventable diseases affecting the Filipino American community, and how can we protect against them?
Uh, for that, there aren't particular vaccine preventable diseases, I think, that affect the Filipino American community more than other racial or ethnic groups. For instance, I think the among the top ones of concern, well, COVID, of course. There's still like measles again, with and old diseases like measles and pertussis, whooping cough. Which were extremely preventable, but unfortunately, with the decline in childhood vaccination rates over the past, well, this was occurring even before the pandemic, but even particularly since the pandemic, it's been particularly challenging. Maybe if one sort of vaccine preventable disease that affects Asian Americans in general more would be hepatitis B, for instance. Which is very common among Asian Americans, Asians, mostly immigrants, so Chinese, Japanese, Koreans, Filipinos included. And it's a very common cause in those countries and here of cirrhosis and liver cancer. Of course, the issue there, it's now hepatitis B is a routine childhood vaccination, so it's not an issue both in Asia and here among kids, but it's more of among the older patients, immigrants, and screening. So more of screening, finding people who do have silent sort of chronic hepatitis B, more so that they can get treated and hopefully or screened for cancer or cirrhosis and catch these before they become more advanced.
Dr. Barroso, if you don't have anything to add, I can ask another question.
Yeah, I agree with Dr. Abiad. There's no specific preventable diseases among Filipinos. All of these, like the COVID and the flu, they're global, preventable diseases. It's not just among Filipinos. It's everyone is affected by these preventable diseases globally.
Thank you both. The next question, how do vaccines impact community immunity, especially in densely populated Filipino American neighborhoods and households?
Dr. Barroso, do you want to?
So, well, like in New York City, the borough that is more of Filipino, like Queens, which I would say that the more densely populated Filipinos are in Queens. So, I mean, even then, I mean, I cannot say that they have more COVID cases or flu cases in there, because again, it's not specific just for Filipinos. We have other infectious diseases that are more common among Filipinos, like tuberculosis is more common, but these preventable diseases, I mean, it's not specific that a densely populated Filipinos will have more cases.
Yeah, I think I agree. It's sort of in general, and yeah, there are sort of Filipino American communities where there's sort of like fairly dense populations in certain cities, but also just in general, again, often we live in multi-generational family. So even if you're in the suburbs in wherever, Minnesota somewhere, but if you have Lolo, Tito living, a cousin living all in the same household, sort of, there's a lot of opportunity for someone bringing in a viral infection. So whether it's a densely packed community or just sort of, yeah, living densely in one household, very important for everyone, particularly those who have high risk conditions and all those around them to get immunized.
As you mentioned, it's very common for us Filipinos. We're very close-knit. Family is number one, and there are many instances where several generations live in one house. I remember one of the very common questions is how important really is it to like wipe surfaces? Say I am COVID positive and I'm hiding in the bedroom and everyone else shares the same space. I share the same bathroom, the same kitchen. Is COVID, which still is very much a thing, able to survive on surfaces, and how
And again,
vigilant should we
that's
be?
sort of something we were very, very concerned about earlier. And of course, you have all these studies, they find the viral particles like everywhere you look. Um, Obviously, now it's sort of not critical. Again, if you're really trying to be careful, and certainly sort of like with any of these things, it's sort of depending how much risk there is. And certainly if there's someone in the household who's getting cancer chemotherapy, then you want to be extra careful and sort of make sure that after, if you had to share a bathroom, that after someone with active COVID uses the bathroom, then the surfaces are cleaned before Lola, who's getting chemotherapy, uses the same bathroom again. How high is the risk? Maybe not very high, but she's very at risk for severe complications or death. So then it makes sense to use those precautions.
Yeah, there were so many misconceptions about COVID, and not everyone knows that COVID is a droplet organism, which is about slightly bigger than TB. It's more than 5 microns. So even though you're close, as long as you maintain the distance of, we say, 6 feet, there's less likely for you to get the infection. And there's so many misconceptions that if you touch something, with somebody that has COVID, you're gonna get COVID. And that was a big misconception because it's COVID is a droplet, and it's still in the air. It's still considered an airborne. It's just that it's a little bigger, so it can only travel a distance of 3 feet. That's why our public, we advise for the public to maintain a distance of 6 feet. But it's a droplet infection, so you can get it through the air. It's not that you can get it through contacts, and
Right.
that is a big misconception about
I
COVID.
agree. So again, more it's the airborne transmission that's the greater. So if anything, if you're trying to be careful, something also at home, especially if they can't like really quarantine, like I could be in a completely enclosed room, is the household like air filter. Sort of we don't pay as much attention to air quality in our homes, schools, offices, but yeah, now they're fairly cheap, easy to buy, and so like we have a HEPA purifier. It's good for COVID. It's also good for when you're cooking tuyo.
May I ask a question, please? So, hello,
Hi,
can you hear
please
me?
go ahead.
Hi,
Yes.
it's Jonah. So if someone has COVID and cough and it drop, like sitting on a table, so it would be on the surface, right? It would be on the table surface. Would that still be? Would you be get would you get infected from that? I'm just trying to figure out if when it hits the table, is it like C. diff where you could get infected?
COVID is an airborne disease, so you can get COVID by inhaling the organism.
So once it hits the table,
Once it hits the table, it's not anymore viable.
okay,
You have to get it through inhaling it through the nose.
good. All right.
Yeah, certainly. Yeah. Again, and although sort
Thank
of
you.
for just since we're talking about flu as well, so flu also primarily droplet uh, um, uh, spread through droplets, but can be sort of viable on surfaces for short uh, uh, that time period. So again, when you're out in public and same thing for the cold viruses. So again, when you're out in public, touching doorknobs, again, it's always important, yeah, try not to use your hands, use your elbow to push the door. If you use your hand, clean your hands, and certainly avoid touching your eyes or your nose unless you've been able to sanitize your hands. Because again, this is respiratory virus season. We get flu, we get COVID, we get colds, we get RSV, and all of those, yeah, again, are transmitted primarily airborne, but those other viruses can be transmitted through fomites and surfaces as well.
So I have another question, if I may. So a couple of months ago, I had a respiratory symptoms. So I went to the physician, and everything was negative. All the multiplex COVID was negative, but I have the symptoms. So I was told that it might be a COVID, but it still didn't brew yet. It's too early. So that I was just confused about that. So I'm getting symptoms again today. And, if I'm going to go, everything would be negative, but then I have symptoms. It's so interesting. What is your thought on that?
Yes, the disease sort of process has changed somewhat. Initially, especially at the height of the pandemic, we were it all clear like very soon after you became symptomatic, and even just before you became symptomatic, the viral load, the shedding was very high. So the tests were almost always positive. Now that we've all been sort of exposed to some degree, either through vaccination or through natural exposure and immunity, things have changed a little, so now we don't sort of early on in the disease shed as much virus, so that it's felt that especially in the first sort of 3, 4, 5 days, you might not have a positive, you might have COVID without a positive test. So if you're sick and it might be COVID, if it's negative, it's recommended to repeat testing after, say, 48 hours.
Yeah, so
Okay, thank you.
COVID, flu, and RSV, they share the same symptoms because they're all respiratory diseases. So in order for us to know, you should get the test. So you would know if it's COVID or if it's RSV or if it's just plain flu.
Thank you. And thank you, Jonah, for your questions. It's nice to hear from our audience here tonight. Another question that we have here, what are some strategies that we could implement to increase the vaccination rate in our underserved communities?
Dr. Barroso, you want to?
Yeah, I think I addressed that in my slide. Let me just go over again.
Certainly among the measures is educational programs like this one, to educate not just the participants, but hopefully everyone who's listening tonight will also go out and share this, what they've learned with their loved ones, friends, families, coworkers. Go ahead, Dr. Barroso.
Yeah, I think the most important is education. We really need to educate people about the importance of getting the vaccine and dispel vaccine doubts and, and promoting and building trust among communities, because that is the big problem, the trust. They do not trust that the vaccine will protect them 100%. So education is very important.
And then
I just
go ahead, Andrea.
And I just wanted to add to Dr. Barroso's point that a step even further about combating distrust is having forums like this where we share like a cultural background, and it makes it feel a little bit more accessible and like really applicable to me, as opposed to just reading, the CDC's report, something that's catered to our community, Filipino communities, and common misconceptions.
And also just increasing access. Again, like in any sort of changing behavior, making it easy for people to have a certain behavior certainly facilitates that behavior. So yeah, sort of, vaccination drives, at the church, having a vaccination station there when mass goes out on a Sunday in the fall or winter, things like that, bringing so that, it's right there. It's easy. I don't have to make an appointment with my doctor, my pharmacy. So again, just making it easy for people in the community going to where they are and making it easy for them to get the vaccines.
Yeah, it should be available to everyone.
Thank you. And if I may ask one more question, I know we're running a little bit over time. It's 6:42 here in California. Is it possible to catch the flu or COVID after being vaccinated within the time frame it should be active?
Yes, I think both of us sort of did mention that they're not 100% effective in preventing infection. So yes, you certainly can get and I'm sure we've all sort of had friends or family who said that, oh, I got the flu shot this year and then I got the flu. Yes, again, these vaccines are not there. We don't take them to completely prevent infection because they're not able to. But if you do get the infection, they're usually milder, and certainly in those in high-risk groups, they again significantly decrease the risk of severe illness, hospitalization, and death.
And I just want to add, and according to studies, these vaccines, they become effective in 2 weeks. So if the person was vaccinated today and exposed tomorrow, the person is still going to get the infection because it takes about 2 weeks before they become effective.
So I know I have heard of this amazing drug called Paxlovid that we can now take in case you get COVID-19. Is that recommended now for any age, or is it still pretty much solely for the higher risk older population?
It's mostly for the higher risk, but certainly any it's available for any sort of proven sort of COVID cases. It does decrease the duration of symptoms. Sort of depending in the past, sort of the main restrictions back then, especially when it was first available, was just because of the amount, the sort of it. They didn't want to make sure there was enough of it so that if people at highest risk got sick, that would be there. But now sort of, yes, certainly I think there's plenty for those whoever needs it. again, it does shorten the duration of symptoms, but again, it's not, if you're otherwise healthy, it's not absolutely necessary either. It has side effects, sort of Paxlovid mouth was what most people complain most about. But yes, it's an option. Discuss with your doctor.
And there's an indication on when to start the Paxlovid. It should be within 5 days of
Right.
infection.
Wonderful. Well, if we don't have any more questions from our participants, thank you, Dr. Barroso, Dr. Abiad, for being with us this evening. It was such a pleasure being in this meeting. Thank you for
inviting
sharing
me.
your time and your expertise with us.
Thank you for
And thanks everyone for attending.
Thanks, everyone.
Thank you for listening.
Stay well, everyone. And
Thank you po.
you haven't
Ingat.
gotten your
Happy holidays
vaccines
to
yet,
everyone.
go get protected.
Get it now.
Yeah.
Thank you. Bye
Okay.
po.
Thank you.
Bye-bye.
Bye-bye.